Hello everyone, I am Sandra May Ivanyola from BSN 111A, and today I am going to do an assessment of cardiovascular system. This system is commonly known as its purpose is to supply blood in our organs to provide oxygen and nutrients so that our organs can function very well and effectively. So in other words, it is important for it helps the body meet the demands of the activities that we do in our day-to-day life. So prior to the procedure, I am going to close the door to ensure my patient's privacy, provide adequate lighting for the patient's comfort, and of course to introduce myself as well as explaining the procedure that I am going to perform. In this procedure or assessment, the equipment that we are going to use is the pen light, the rectangular cord, then the ruler, and of course the stethoscope. But before all of that, I am going to perform hand washing to prevent or protect ourselves from any microorganisms that we can get during the procedure. So, let's go. Hello ma'am, good afternoon. I am Sandra May Ivanyola, your strength nurse for the day. Can you please state your complete name?
Princess Diane G.L.
Your birth date and civil status, please.
January 6, 2004, Sierra.
Okay, thank you very much. But before we proceed, may I ask, what should I call you?
Diane.
Okay, Ma'am Diane, I am going to assess your cardiovascular system, which means I am going to check for the pulse in your neck, arms, and legs, which involves touching the other parts of your body. Is that alright with you?
Yes, nurse.
Okay, so let's start with a short interview. Do you have any specific feeling of pain in your chest?
No.
How about the other parts of your body?
No.
Okay. Have you experienced dizziness in the past few weeks or days?
No.
Headaches?
Sometimes.
Okay. Do you have any history of hypertension?
No.
Any coronary disease that has affected your family?
No.
Okay. Have you tried smoking?
No.
Okay. May I ask what are those activities that you do in your day-to-day life?
Waking up early, help my grandmother to clean the house and answer messages.
Okay. Have you tried exercising?
Sometimes I use dancing as my exercise.
Okay. Thank you very much. Do you have any clarification or questions?
None.
Okay, so let's start with assessment. Let's get started with the assessment of the jugular vein and carotid arteries. By inspecting these vessels will provide information about the blood volume and pressure on the right side of the heart. Okay, Ma'am Diane, I need you to lie down with your back. Is that alright with you?
It's alright, nurse.
Okay, we need to make sure that the head of the bed is elevated between 30 to 45 degrees so that the head and the torso of the client or patient are on the same plane. Okay, Ma'am Diane, I need you to turn your head slightly onto the neck, left, for I will show this pen light onto your neck. Is that alright with you?
It's alright, nurse.
Okay. Don't forget to observe for the pulsation or shadows under the clavicle area. Okay, thank you. So, if jugular distension is noted, assess for the jugular venous pressure by locating the highest point of view of the interjugular vein by emphasizing it through the light from the pen light. If deemed necessary, raise or lower the head of the bed by 30 to 45 degrees, 60 or 90 degrees until the highest point of view of the interjugular vein was observed. Note that the jugular vein should not be distended, bulging, or protruding, for it will only indicate right-sided heart failure. Okay, so now to measure the distance of the sternal angle, we'll be using a long rectangular cord horizontally and using a centimeter ruler vertically from the sternal angle. Okay. Okay, so now to assess the carotid arteries, I'm going to instruct the patient to turn her head or position her head towards my side so that I can palpate and auscultate her carotid area carefully without putting too much pressure on it. Okay, Ma'am Diane, I am going to touch and inspect your pulse in your neck. Is that alright with you?
It's alright, nurse.
Okay, Ma'am Diane, I need you to hold your breath for a moment for I'm going to auscultate your carotid area to check for any brewy sounds. Is that alright with you?
It's alright, nurse.
Okay. Inhale, exhale, and hold. Okay. Inhale, exhale, and hold. Okay, thank you. So now let's proceed to the chest area. But before that, we'll be having a general inspection to check for any signs of pulsation, symmetry of movements, heaves, and retractions. Also, make sure that you'll ask permission to the patient, especially if the patient is a girl, before doing the procedure right away. Okay, Ma'am Diane, since now we're done doing the carotid arteries, we're going to proceed with your chest area, which means it involves touching your breast. But if you're not comfortable, instead of me touching it, you'll be doing the procedure and I'll be going to instruct you on what to do. What option or which option you choose?
The option 1 would be fine, nurse.
Okay. So, can you please inhale and exhale? Okay. So, in terms of palpating the pericardium or pulsation, while palpating the aortic, tricuspid, pulmonic, and apical pulses or area through palpating the chest by using my finger pads. Now, place a ball of a hand firmly on the chest to check for buzzing or vibratory sensation. In aortic, pulmonic, and tricuspid, I'll be using my finger pads lying flatly on the body surface. Now, to inspect for the apical impulse or apical area, I'll be using the 2 or 3 finger pads. Use one finger to check for the characteristics of the apical for its location, diameter, and amplitude. If still not detected, have the patient roll over to the left side and palpate it again. Okay, Ma'am Diane, I need you to exhale fully and stop your breathing. Is that alright with you?
It's alright, nurse.
Okay. Inhale. Exhale. Stop. Inhale. Exhale. Stop. Okay, thank you very much. Now you can now lie down again. So let's proceed to inspecting and palpating the epigastric area of the patient. Okay, thank you very much, ma'am. To assess the heart rate and rhythm, I'll be going to place the diagram on the apex and listen closely to the apical impulse. After that, I'm going to auscultate the heart in all anatomic sites to check for any heart sounds or murmurs. Okay, Ma'am Dayan, I just need you to breathe regularly as I auscultate your heart. Okay? Okay. Okay, Ma'am Dayan, can you roll over at the left side to check for other heart sounds and murmurs? Stop. I need you to stop your breathing after inhalation. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Okay, Ma'am Dayan, I need you to stand up or sit and slightly lean forward. Inhale. Exhale. Inhale. Exhale. Okay, thank you very much. Okay, Ma'am Dayan, I am going to check for your arms to check for your body temperature, skin discoloration, and if there's any signs of skin lesions. Let's start with your right arm first. Okay, your body temperature is warm and your skin color is consistent and there's no signs of skin lesions. Okay, your nail beds are pinkish and there's no signs of early cracking. Okay, I'm going to palpate for your radial pulse, ulnar, and brachial. Let's start first with your radial pulse. Then your ulnar. Okay, your brachial. Okay, let's do a capillary level test where it helps reflects your cardiac output. Okay, your capillary level test is good. So we'll proceed to the Allen test to test the potency of your ulnar and radial pulse. So Ma'am Dayan, I need you to move your hands like this, open, close, as fast as you can as I squeeze your radial and ulnar. Okay? Okay, nurse. No. As fast as you can. Squeeze. Squeeze. Do it again. Squeeze. Again. Squeeze. Okay. The other one. Squeeze. Again. Squeeze. Okay, thank you very much, ma'am. Okay, so now we're done doing your upper extremities. Let's proceed to your lower extremities. I am going to inspect and palpate for your legs to check for the body temperature and to check if there's any signs of skin lesions present. Okay, I'm going to palpate now. Okay, your skin color is consistent and your body temperature is warm and your hair is evenly distributed. So let's proceed to checking for edema, swelling, varicosities. Okay, so I don't notice any. Let's check for the firmness and tension of the pulse. Anyone? Okay, so far so good. So let's proceed to the palpated pulse. Okay, Ma'am Diane, I need you to raise your right knee first in order for me to check and palpate for your palpated pulse. Okay, other one please. Okay, so far so good. Both have regular rhythms. Let's proceed to your dorsalis pedis. Okay, both have regular rhythms and equally strong. Okay, let's proceed to your posterior tibial. Okay, both are equally strong and have irregular rhythms. Okay, let's proceed to the Human's test. We'll start with your right knee first. Okay, the other one please. Okay, let's do a capillary refill test. Your toes. Okay, so far so good. The result of your capillary refill test is good. Okay, thank you very much, Ma'am Diane. Okay, Ma'am Diane, so now we're done with the procedures of your cardiovascular assessment. To sum up all the results, that everything we have covered upon the auscultation of your neck, I've heard a whooshing sound, and your pulses are both equally strong, which is graded with a 2+, which means it's normal. So in the assessment of your chest is symmetrical. There's no signs of retractions, hives, nor trills. Then your heartbeat is also 78 beats per minute, which means it's normal. So in the upper and lower extremities, your arms are bilaterally in minimal in size. No edema or skin lesions present, and your skin color is consistent. And your capillary refill test, where I pinch your nail bed, also have a good results. And the performance of your Allen test, where I instructed you to close and open and squeeze your hand, which also have a good results. In terms of your lower extremities, your legs have an evenly distributed hair, also have a normal body temperature. There's no signs of redness, swelling. There's no signs also with the skin lesions. And the pulses, the 3 pulses that I have palpated earlier, also have a growth results, which these are normal and have a strong rhythm, and both are equally synchronized. As well as in the ulnar, the brachial, and the radial pulse that I have palpated in your arms earlier also have a good results. So that's all. Do you have any clarifications or questions to ask?
No, so far so good.
Okay, thank you very much, Ma'am Diane. Don't forget to eat healthy food and exercise to help your stamina to get stronger and to avoid you getting any heart complications in the future. Thank you very much and have a nice day ahead.
Thank you, nurse. And have a nice day.